Wait, a shot? I have to give myself a shot? I have to give myself a shot in the stomach? Hi, this is Erin yet again. Stay tuned, and I'm not only going to talk about giving yourself a shot, I'm going to actually demonstrate it. Stay tuned for my video. Good night, good evening, hello, hi, how are ya? Happy Friday. We're gonna do this video, we're gonna do it. My name's Erin, of course, as I mentioned before. I'm a nurse. I also happen to have multiple sclerosis. So my aim ultimately is to help those of you out there with a new MS diagnosis and those first few months of kind of getting through it. And that's what I aim to do. So today I'm gonna talk about medication and specifically giving myself my medication, which for me is Kesimpta. It is an injection. Yes, it goes in the stomach. And I know that first, freaks everybody out going, oh my God, it's a needle. Yes, in the stomach. However, a couple things to keep in mind here. Number one, it's not a super huge needle. In fact, it's a teeny tiny needle. It's very small. Pardon my nose itch. Very small. It's also a brand new needle, which means it's very sharp. And that's a good thing. You want sharp. You don't want dull. It's gonna hurt if you have dull. You want sharp, it just goes through, boom. There is many times that I have given myself this shot and I don't feel anything. So it's great that way. I also love it for the convenience because, I don't have to go set up at a whole infusion clinic and take the whole day. It's just been great that way. So, so I'm going to demonstrate it. Without further ado, this will be a quick video, nothing major. I'm also proud to say, yes, I feel gross and bloated and I'm 47, so I do not have the Elle Macpherson body that I would love to have. Oh well, what are we gonna do, right? So here it is, Kesimpta. This is what I'm going to be giving myself. This normally comes shipped to you. It'll come with a bunch of ice packs around it. It needs to be cold until of when you're actually going to administer. So once you get it, if it's not the day that you're supposed to get it, then put it immediately in the fridge, keep it cold. And then when you do, you're going to take it out and you're gonna let it get roughly to room temperature. So about 10 to 15 minutes. If it's too cold for this particular medication, or if it's really cold, you'll see that this liquid in here looks really cloudy. Obviously, you don't wanna give yourself a cold shot. Nobody wants a cold shot unless you're at the bar, bun-up-ching. We want a warmer shot. The other thing with this particular manufacturer that makes this medication, I'm not sure who is this. Is this Biogen? Is this, Novartis. Novartis, they will send you with most patients, they'll send you a whole bunch of stuff, and one of them is a practice pen. So you can kind of see what it's like. So what you're going to see is I'm going to push with this. You're gonna see a little green kind of line slowly fill in here. And that means that the medication is going in. So, and then once it's all green in the window, you're done. And zip zap, that's it. Very easy. So, without further ado, I guess I'll go ahead and we'll do this because this is ready to go. Supplies you will need, aside from your medication, if you wanna go super by the code, by the book, you could use gloves. However, my hands are clean, they're not dirty, so I trust myself. It's my own body. I don't feel I'll be passing germs to myself. One alcohol wipe for the site that you're going to be injected. You're going to clean the site with alcohol, and then you're gonna let it dry. So that is what we're going to do. And here we go. So, yes, all right. Hi, what's going on? This is not something that I'm used to doing. I am going to cover up a little bit and be a little bit modest. So I'm gonna go ahead and inject this site. I got an inch and then some. So that's what we're going to do. I'm gonna give myself an inch here. I'm gonna grab my bike tire and I'm going to clean it. Let it get nice and clean. Scrubba. All right, there it is. Here's my pen. I'm going to take the lid off because I'm gonna hold my shirt up. Yeah, I know. Hold my shirt up. Here is what it looks like. That's the end of it. Now, I don't know if you could see that. All right. The site is dry. I'm gonna try to stand up where you can see it. Ready, set. Oh wait, let's go this side. Let's go this way. Okay, ready, set, and straight in. You might see the line. And you hear that other click? I'm done, pull out. That's it. This is what it looks like when it's done. Do you see how it's all filled in with green? And that is it. I'm just gonna recap it just because I don't know what else to do with the cap. I do have a sharps container, so I dispose of this in a red sharps container that they normally provide. I'm gonna look right now. I see nothing. Sometimes you might see like a little tiny drop of blood, but I didn't feel, honestly, through that, I didn't hardly feel a thing. Yeah, nothing. So it's great. I do this, the timing on this too is like, say, I do this every first Friday of the month. That's usually how they'll want you to do it, just as another little bit of information if you happen to go on Kesimpta. So let's say you start on a Monday in the middle of the month, then you're gonna wanna do it on that subsequent Monday of the following month. You just, however you time it out. It's usually how it needs to be given. So that's it. Thank you so much for watching. Please like, comment, subscribe, all the things. And do reach out to me. I am out here to help those of you. I know I'll put my email down there. And let's connect, because I would love to, anything that you need to try to cope with this disease. It can be rough, certainly with the first diagnosis. So don't hesitate, reach out. Otherwise, everyone have a great weekend and take care. Bye-bye.